Hello everyone, my name is Melinda M. and this is Ivy Lee, and today we will be talking about the current public health issue known as coronavirus, officially named COVID-19. COVID-19 is an infectious disease caused by a newly discovered coronavirus. It has now become a pandemic reaching many countries such as Italy, South Korea, China, and the United States, and many more countries. So what is COVID-19? Well, according to the World Health Organization, most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. The virus is thought to spread mainly from person to person. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. So part of COVID-19, there's an incubation period. The incubation period is the time an individual gets exposed, but symptoms are not apparent to the time of the sickness to occur. The incubation period for coronavirus is between 2 to 14 days. Some notable symptoms include fever, coughing, and shortness of breath.
Risk factors are defined as any behavior, knowledge, or decision-making of what leads to the illness or disease. Therefore, what we do can greatly increase our likelihood and our chances of being infected by COVID-19. Risk factors for COVID-19 include being in close contact. Other risk factors include not covering your mouth when you cough or sneeze, also not washing your hands with your soap and touching your face with your unwashed hands, not staying at home and practicing self-quarantine when you feel sick, and not practicing social distancing, such as hanging out with your friends or attending a social gathering and being in close contact with people.
Since there is currently no vaccine to prevent coronavirus disease, there are protective factors to prevent illness. These include 1. Coughing and sneezing into your elbow. 2. Wash your hands often with soap and water for at least 20 seconds. 3. Do not touch your face, especially with unwashed hands. 4. Clean and disinfect frequently touched surfaces daily. 5. Keep at a safe distance. You want to avoid social gathering and practice social distancing to reduce contact. And lastly, stay at home. So how does the coronavirus affect the behavior of others? Well, as the spread of the coronavirus continues, individuals are making changes in their consumer behavior. People are shopping in stores less, shopping online more, shopping at less busy times, and stocking up on basic supplies as well as medical and emergency supplies. Not only do consumer behaviors change, but individuals are limited upon doing daily tasks.
Effects on attitudes. For those who have been infected by COVID-19, their attitudes may change. They may now have a different perspective of the disease, viewing it as more severe and life-threatening as they are now battling the disease firsthand. Those who are not infected by COVID-19 may also have changed attitudes as well. People may be more avoidant towards one another, in fear of one or the other having or spreading the disease. They are also more likely to be avoidant towards those with confirmed cases of COVID-19, as they do not want to run the risk of contracting the disease.
How does the coronavirus affect our decisions? Well, the outbreak has opened the eyes of many individuals, affecting their decision by focusing more on needs than wants and becoming more practical and realistic in when to go out, what needs to be purchased, and start practicing and being more sanitary.
Health effects of COVID-19 on the body. COVID-19 is known to affect the respiratory system as it tightly binds to the receptors in your lungs. This can cause respiratory issues, and those infected by COVID-19 may experience symptoms such as sore throat, cough, and difficulty breathing, such as shortness of breath or tightness in the chest. They may also experience persistent fevers as your body is fighting this infection, and extreme fatigue. The lungs are usually the first organ to be damaged. In patients who become severely ill, they may also develop dysfunction in other organs such as the stomach, intestine, liver, and kidney as a direct result of the body's response to the infection. Social consequences. As a direct result of COVID-19, measures are being implemented to help flatten the curve. For example, the Los Angeles County has implemented a safer at-home order, encouraging people to social distance and stay at home, and only allowing people to leave the house for essential purposes. Only businesses considered essential are allowed to conduct business. As for personal consequences, there is also increased stress. These stressors stem from trying to survive through this pandemic. Stresses like losing your job, the financial instability and inability to pay for bills, the worries of you or your loved one being immunocompromised and contracting the disease, and the worries of food insecurity, all of which can trigger anxious and depressive episodes. Human interaction, such as physical touch, are also lost. Many people who struggle with mental health depend on their social distractions to get through their day. This may further worsen symptoms of a pre-existing mental health condition the individual may have, such as depression.
Now that we have provided you with some information about the coronavirus, here are ways to take action.
Don't touch your face, wash your hands, social distance yourself, disinfect, prepare and stock up on food, but make sure no hoarding, and most importantly, stay at home. If you want to know more of any updates in regards to COVID-19, please check the links in the description below.